Good day, viewers. My name is Dr. Uzoamaka Ezenwugo from the Department of Community Medicine, UNTGT Kwazala. I'm here today to talk to us about a very important health condition called cervical cancer and the importance of its screening. Cervical cancer is the cancer of the neck of the womb in the women and is caused by a virus called human papillomavirus, HPV. This virus presents a significant public health threat to women, especially those in the African continent. Cervical cancer progresses slowly from a pre-cancer stage, that's the stage before the cancer sets in, to an invasive cancer stage where the cancer has already set in. But it's very curable if it's diagnosed and treated early. The tragedy is that while this type of cancer is very preventable, poor access to prevention, screening, and treatment contributes to 90% of deaths. Everyone who is sexually active eventually becomes infected with HPV at some point. The truth is that males are carriers of this HPV, but because they don't have cervix or neck of the womb, they don't suffer from cervical cancer. But when the women contract this virus, it can affect them because they have the cervix. Now, there are so many strains of this human papillomavirus, but two, type 16 and 18, causes over 70% of cervical cancers and precancerous cervical cancer lesions in women. There are risk factors to this cancer. 1. Any condition that reduces the immunity of the woman or reduces her ability to fight off illnesses, including HIV infection. People that are not vaccinated against HPV, people that have co-infection with other sexually transmitted diseases, such as herpes simplex virus, chlamydia, and Neisseria gonorrhea, which is the organism that causes gonorrhea. People who have multiple sexual partners, or whom their partners have multiple sexual partners, or who participate in high-risk sexual activity. Smoking is a very important risk factor and is dependent on how much smoke the person consumes and at the age which this person started smoking. People who also engage in long-term use of oral contraceptives are also at risk for cervical cancer. Now, early-age cervical cancer generally produces no signs, so you won't know that you have cervical cancer. But people who get screened regularly detect these abnormal occurrences on time and they are treated. There are symptoms of this cancer. We have the early symptoms and symptoms of the progressive cervical cancer. Now, I'll begin with the early symptoms. First, abdominal vaginal bleeding. This is bleeding between periods or after intercourse or after menopause. Abnormal vaginal discharge, which can be pale, watery, pink, brown, bloody, or even foul smelling. Women that have heavier periods that continue for longer than usual time. These are also early symptoms, and you need to go and see a doctor to get screened to be able to know whether it's actually cervical cancer or something else, and it's treated early. Now, these other signs I'm going to talk about shortly are the signs we call symptoms and signs of progressive cervical cancer. That's when the cancer has progressed. In addition to the symptoms I mentioned earlier, you can also have lower back pain or leg pain or swollen leg, bone fractures, unexplained weight loss, in addition to all the early symptoms I mentioned, including abdominal vaginal bleeding. Remember I mentioned that this cancer is very preventable. We have the primary prevention and the secondary prevention. Primary prevention has to do with vaccination. This human papillomavirus has a vaccine that, which when taken, can prevent someone from coming down with cervical cancer later in life. World Health Organization recommends that adolescent girls aged between 9 and 14 years get 2 doses of this HPV vaccine. The second dose is usually given 6 to 12 months after the first dose. Secondary prevention has to do with screening and treatment of these cancerous lesions. Again, WHO recommends that screening for women aged 30 to 49 years through pap smear and VIA, visual inspection with acetic acid. These tests are very easy to conduct. They are not painful. They are less stressful to conduct. And when these results come out immediately, the women can be treated immediately. Women who test negative can be rescreened within 10 years, but the most common recommendation is to do a pap smear after every 3 years. Remember that cervical cancer is very preventable and early detection can save our lives. Go for your pap smear today. If you have any questions or any contributions or any clarifications on this topic, please contact this number showing on your screen or go to the nearest health care facility close to you. Thank you.